that. To introduce myself, I'm Tiffany Neal with the Next Level Nurses. I help untraditional students get into nursing school and crush those classes and clinicals and survive nursing school and even thrive there without losing their minds. I also help healthcare professionals pivot from bedside to business. So I'm happy that you're here. Welcome, welcome, welcome. I want to pop in where you're tuning from and pop in any burning questions that you have. So last week we went over 5 essential strengths that help create a realistic roadmap to assisted living facility ownership. Tonight we're doing something absolutely different. Tonight I was thinking about an idea that someone gave me, and they were like, hey, I've been thinking for a while about doing a psychiatric rehabilitation program. I'm in the planning stages of it. I want you to look into it and see if this is something you'd want to do or be a co-owner about. So that is what we're going to be talking about today. I am going to be utilizing a few tools to research, and I'm going to be showing you my screen so that you see what I'm searching up. You see the questions that I'm asking. You see the information that I'm getting in real time. I have not done this before. Just so you know, I will use AI, and I have to give a warning about AI in general. When you are using a chat bot, you need to recognize that it is a chat bot. It is a large language model that formulates its response on predictions of what's statistically appropriate to respond to your input. So I have this phrase, and it's going to sound harsh, but it's ChatGPT is an idiot and a liar. And once you know those things intimately and accept them, then you can use it as the tool that it is. ChatGPT is not your second brain because it can be incorrect. AI can do something called hallucinate, which means it can make up facts and it can make up information that sounds very convincing, but is incorrect. And now that I'm talking about this on its live, I kind of just, I'm probably going to have to do a video about it, to be honest, about AI, appropriate use versus inappropriate use in healthcare and business planning, et cetera. So everything that AI tells you when it involves your financial decisions, like creating a business or developing a business plan, it's giving you templates, it's giving you application tips on things that you need licenses for. You have to accept that it can be wrong and that you must double check everything because it will hallucinate with incredible confidence and it will get you caught up, okay? Especially in healthcare. So I say that with a caveat. I will be using some AI tools potentially, but usually I use that in like preparation to just make sure if I have a checklist of things I want to check out about a particular business model or particular industry, I'm going to input my list of questions and say, do you see any blind spots and how could they affect me? That's a different thing than saying, hey, draw me a business plan for scratch in Sunnyvale, California to make my own psychiatric, full service clinic. That is a big task for AI to complete, and they don't know all of the regulatory information that a human being would. So you just want to use it with caution. So there's a bunch of things that I kind of want to find out when it comes to PRP. PRP is basically a program that's set up to give support to people who have psychiatric or mental illnesses, diagnoses, right? I worked as a PRP counselor, okay? I worked as a PRP counselor. I really loved it. It was fun. It was excitable. Hello to everybody that's coming in. And that was way back before I had even finished my first bachelor's. I knew like mental health is it. And I wanted to get work in the field with real patients or real clients before dedicating more of my life to that, to just make sure it's not something fun in theory. So in that center, there is okay, thank you for letting me know that the meeting is being transcribed. Amazing, amazing. Welcome to everyone who's coming in. It let me know that there's a structure to these things, and it's very, very fun. It's very, very serious. It's heart-wrenching at times, but it's definitely something that is needed. So I saw the levels with a psychiatrist or prescriber, several therapists that do talk therapy. So that would be like cognitive behavioral therapy, dialectical therapy, and then the counselors that would do in-house visits or have the clients come to the office as well. But we would be going out to where they were in the community. And when I did this, I worked in Baltimore City, where I was born and raised. I went out to the community. I went to shelters. I went to halfway homes. I went to hospitals when they were discharged from inpatient psychiatric care. I went to their homes. I went to townhomes. I went to anywhere that they were. Sometimes the grocery store, Lexington Market, which is more of like a bazaar than a grocery store, but I would meet them they wherever they were, whenever they had time, check up on them, see how they were doing, see if they're taking their meds, seeing if they're having bad side effects, seeing how they're feeling, and how close we are to reaching the goals that we set out when I first started meeting with them, that we identified together, and help them along those goals. So that is the idea of how a PRP is segmented and how that's structured. We have prescribers, we have therapists, we have counselors, and together they work as a team, and they each have a certain amount of clients in their books, or, as their roster. So I have, again, a close friend, a family friend, who was thinking about doing this and had me thinking about it. So off the top of my head, just from having worked in assisted living facilities, I already know some things that I need to find out that are definitely more high priority than other things. I need to find out, is this a viable business? Who has to own it? Who has to be director? What credentials are required to own and operate one? So I have to know, can I own one with a BSN, which is a Bachelor of Science in Nursing? Do I need to have a nurse practitioner degree or a physician's assistant degree or a doctorate of nurse practitioning or a PhD or a medical doctorate to run, license, et cetera, operate and own this facility? These are things I need to know. I need to know staff requirements, what licenses and degrees and credentials have to be represented in staff, and in what ratios to the amount of patients. I have to know about, is a physical space required? And if it is, what are the specifications of that physical space? What has to be available for clients? Are online providers okay? And staff? These are things that kind of come to mind before I even really look at the specific application. These are some details that I would want to know. So from that and some refining and a little bit of going back and forth, I actually was able to kind of create a framework that can help people that are interested in not just the psychiatric rehabilitation program, but also other healthcare adjacent businesses like IOP, PHP, group homes, ALF, etc. So a good framework to kind of go through that research process in an organized fashion and document your findings as you go along, so that by the end of it, you kind of have a little, hey, I have a case for this. I have a case for doing it alone. I have a case for needing to partner with a collaborating physician. I have a case for needing to pitch this to a medical director and say, hey, let's start this other business. And or I don't have a case. This is not viable for me with my skill set and my current professional network or my current life circumstances. Ultimately, with assisted living facility, I'm very open about the fact that that model did not work ultimately for my husband and I, because of our lives and how we wanted to set our lives up, because we both had some fluctuating health needs, his way bigger than mine, and had to work within, hey, this is the spoons that we have for today. And we wanted to be very involved because it is a 24/7 business. You got to be there 24 hours a day, 7 days a week. And yes, we had staff that was reliable. And yes, we got a manager, eventually. But we still wanted to have that close touch and that close proximity to both our residents and our staff. And that became untenable, especially as I decided to come back to school. So ultimately, that was a place of assessing, is this working for us and our needs, as well as is this in the best interest of the people that we're serving? So you don't know that usually until you do some of this research. And especially when you're screening out ideas early or throwing around ideas early, these are the things you want to do. So I'm going to show you a little bit of my framework. It's not pretty yet, okay? It's not in a beautiful PDF yet. It's very basic at this point, but I will show you, and we're going to go through some of it live. I'm going to search some of these things live, okay? So I'm going to pull up this PDF and I'm going to share my screen. B is for baseline, and we'll go forward from there. But U is for unlock, I is for invest, L is for lead, and D is for defend. But we're going to start at our baseline first. This could also mean this is our blueprint. It's viability. Is this viable for me where I am in my professional journey with my abilities? And we're not going to go through the whole framework today, but we can at least try to look at this phase one, which is blueprint or baseline. So can I legally do this? And is this market still open? It doesn't matter how brilliant a business idea is if you can't do it, right? Realistically, and if the market is too saturated for you to enter the market and be able to make a profit and make an impact as well. So for this, you need to know what credentials are needed to own and operate this idea of a business that you have. You need to know, do you need a medical director that has different credentials than you potentially as the owner? You want to know if a non-clinical person can be an owner. And as far as looking at saturation, you need to know, like in the state of Maryland, for example, where we're going to be doing our search today, they have a moratorium on new licenses, and it just ended recently. But because of them needing to do some investigations, they put a moratorium on new licenses, new applications. They froze and stopped everything, and they started reviewing people that were licensed for compliance. They did this in the PRP space, and they also did this in the assisted living facility space. And a lot of facilities got audited on surprise in the fall of 2025 and were closed on surprise because they had a lot of what is called deficiencies stacked against them that you have to correct and provide documentation of correction. So before I get too deep into this, I'm going to stop sharing this and then I'm going to open up. Oh, I guess I could have continued sharing it from here, but I'm going to open up a Google page. What credentials are needed to own and operate psychiatric rehabilitation program in Baltimore, Maryland? So for you, this search might look like, what do I have to do to open up, a hospice center? It may look different. What do I need to open up a group home for people with intellectual disabilities? May look different. But this is just the beginning of starting to search. This is just the gears turning. We're looking at credentials, okay? So we're going to do the AI overview, but we know our phrase, AI is a liar and an idiot. So we're going to take it with a grain of salt, and we're going to actually try to pull up these regulations. It says to own and operate in Baltimore, Maryland, you have to hire a qualified rehabilitation specialist, which is a licensed mental health professional, a certified rehabilitation counselor, or a certified psychiatric rehabilitation practitioner. It's letting you know that the program does require state licensing. It does also require accreditation. That is different than assisted living facilities. Accreditation is a process that even hospitals go through, nursing homes go through. Sometimes it's optional, sometimes it's required, but that means that there is an additional third party that regulates that type of entity, that type of business in the area that's going to come in addition to the state of Maryland, and that's going to assess your readiness to operate. And you have to get accreditation from them. You also need Medicaid enrollment, a fire inspection, that's pretty typical, and a certificate of occupancy, that's pretty typical. So some of these things I'm familiar with because of assisted living, but some of them are new. We did not need accreditation, we needed state licensing. So staffing requirements. Rehabilitation specialist / program director has to work 20 to 40 hours per week, depending on caseload side, and they have to hold certification from the Psychiatric Rehabilitation Association or appropriate licensure. So what that's letting me know is I need to look into what is appropriate licensure. If I want to do this right now today, before I earn my nurse practitioner degree, my psychiatric NP, I want to know, can I own this with a bachelor's of science in nursing as a registered nurse with an active license in another state? All of those things are kind of like add-on questions, right? So that's letting me know if I'm taking notes in my notepad or if I'm writing things on OneNote where I keep all my records, I'm going to take a note of that as I'm getting this information from Google and as I know to go verify it. I might put a question mark by that. Is a bachelor of science nurse able to be the appropriate licensure for this? Direct care staff, you had the appropriate training and experience working with individuals with serious mental illness. I did have to get training and certification from in-house when I worked as a PRP counselor. So I do remember this. I do have some familiarity with this. And I was direct care staff. They had me watch several videos, do worksheets, do like role play stuff. It was a great place that I worked. Licensed clinicians, individual practitioners, social workers, nurses, counselors must be licensed to practice independently in Maryland. So now that's letting me know one of the answers, one of the threads that I started, do I have to have this in Maryland? Do I have to be licensed to do nursing in Maryland? The answer is yes, per this. And we're going to check out this source as well to just make sure that it's a reputable source. I'm not going to take you guys back to school, but very quick thing on sources. You want to check out what it's quoting when it's giving you these facts. You want to look at all of these, and you know that anything that's supposed to be from a state government, the federal government, your cities or local government is going to end in a .gov website, right? Not .com, .gov. Originally, when they made those extensions, .com is for commerce, right? Means that somebody's selling something. It's not that simple anymore, but .gov was reserved for government entities and government agencies. So we want to make sure, this is regs, short for regulation, .maryland.gov. So we know this is something reputable, and this is something that at this point in my search, I'm going to save this because this is the actual regulations on what is required to do specialty mental health services. And I'm going to look through this and make sure that this includes PRP, right? I'm going to look through some of the definitions, some of the terms, the license requirements, etc. This is what the AI summary or the AI overview is pulling from. So that's really good to know. That's very, very good to know, right? So we know that though we say AI is an idiot and a liar, it is trying to pull from a reputable source, but we do have to read that source and see what it says specifically because sometimes it summarizes incorrectly. All right. So this is something when you find something like this that's for your city, your state, right? Federal agencies that would regulate what you do. Like if it's a private practice and you want to give controlled substances like stimulants. If you're a psych nurse practitioner, then you need to look on the DEA to see what are your requirements to get DEA registration and certification to be able to prescribe that, and that's going to most likely be a .gov website. So when you find the treasure trove of the right information, you want to save that as a bookmark or save that somewhere where you're keeping your notes. So that's letting me know. It's saying, hey, you got to be licensed to practice in Maryland. When it talks about administrative requirements, it's talking about accreditation. What I mentioned before, that's going to be an entity outside of your state entity, like outside of the Maryland Health Department or Office of Healthcare Quality. That's going to come in and do an additional safe check and verification of your records and the physical site and your business plan for viability. So it looks like CARF does that and the Joint Commission. Anybody who's worked in a hospital knows the Joint Commission. When they're at the hospital, I'm not even going to finish that statement, but we're aware that they're at the hospital, and it's a very serious, big deal because hospitals do not want to lose their standing and their accreditation with the Joint Commission. Okay. When I'm seeing this accreditation piece and I'm seeing the Joint Commission, I'm also keeping in mind on my framework checklist, which you can see here, I just switched back to it, right? That is going to be something in the invest area. Accreditation is not the small fees that licensing usually is. Like state licensing might be $350, $500, maybe $1,000. When you're talking about having the Joint Commission come into your medical program, that's typically going to be several $1,000s. Now, I'm just predicting that from what I've seen in my very limited experience. I could be completely wrong, but that is letting me know as I go down this list, this is going to be licensing and legal fees. That's going to be higher than an assisted living facility would be. It's going to be higher than what an assisted living facility could be because it's a whole nother entity coming in, and it's usually not inexpensive. Licensing and certification approval from the Maryland Department of Health and Behavioral Health Administration. Legal standing, you have to have your taxes up to date in the state of Maryland. Don't be in bad standing. And you have to have Medicaid enrollment. So PRP, the one that I worked in we did have Medicaid participants. So again, it gives just a little detail here. It's designed to help adults. It can also help children. Children can be enrolled in PRPs. With persistent mental illness, they're supposed to develop skills for independent living. All right. So here we go here. We have another excerpt of the COMAR. The COMAR for the state of Maryland is like the healthcare Bible, like all of the stuff that you want to start in healthcare, a nursing home, a group home, a psychiatric rehabilitation program. It's going to have those regulations in the COMAR, and they all have their different sections, like ALF's is point 14, I believe. So it looks like 0.09 would be the PRP. And it looks like at this point, it is a difference between the adult program and the children program. So that may be something that I want to note in my notes in this early phase of research that, hey, there may be a different accreditation process for both populations. I may decide based on my interest, my population that I connect with, or even for financial reasons, what I want to prioritize if it's a different process or if there's different accreditation for that. All right, so we're back in the COMAR now. We're looking, hey, in order to be licensed under this subtitle, we have to provide community-based comprehensive rehabilitation and recovery services and supports, including but not limited to community living skills, ADLs, family and peer support, right? We have to promote successful community integration and use of community resources. So unlike assisted living facilities where you are kind of providing a sense of community within that small family home, and then you're potentially socializing them with trips outside, enrichment opportunities. Let's go to the museum. Let's go to the theme park. Let's go to the diner. Let's go to the movies. Let's go here and there. Let's take a hike on a cool day. This is meant to keep them integrated into their communities and use you kind of like an adjunct service to keep them going when they're living with persistent mental illness. So we want to promote successful community integration and use of community resources, and it has to be under the direction of a rehabilitation specialist who's a licensed mental health professional certified by this commission or by this commission. So that answers the question earlier when they say what is appropriate, they're telling you what's appropriate here and who can start this, right? And they're telling you you have to have this person there for a certain amount of hours per week, right? So 20 hours if you have less than 30 clients, 40 hours if you have more than 30 clients, right? 30 or more. And for minors, we have a little slightly different goals, but we have an emphasis on self-care, which is important, resiliency, which is important. We just talked about resiliency in one of the last videos that I was editing. You'll see that in maybe about 3 weeks or 4 weeks. Talk about social, appropriate peer-to-peer interactions, teacher to student interactions, semi-independent living skills, and still promoting successful integration, right? So when you are wanting to help minors, we can see the program has to be under the direction of a rehabilitation specialist who has a minimum of 2 years direct care experience with youth with a serious emotional disorder, right? So this is a different caveat than up here with working with adults. So remember when I told you, when we're looking at viability, we're figuring out, am I eligible for this? Do I know someone who's eligible to do this and who is solid enough and professional enough and interested in doing this with me that I can partner with? And is this realistic for my life and my situation? If you don't have that background and you don't know someone that has that background, then you may decide to launch a PRP that serves adults until you get that experience or add someone to your team that can be there a certain amount of hours per week that has that experience. This is one of those things that can be a make or break. And this is why this starting at the baseline and developing this information early, getting your basis on where you're going and what the goal is and is it viable for you is why it's essential, right? So we're not going to get too deep into the weeds. I kind of just want to give y'all an idea of the framework and how I would look for this. So I already talked about this on my own checklist. Can I own this with my current license? I have a BSN and I have my active registered nurse's license that is a multi-state license in all compact states. So now that my home state is a compact state, I do have an active registered nurse's license in all other compact states. But is it the specific type of license that they're talking about here? From my understanding right now, no, it is not. I would have to speak to somebody in the state of Maryland that works with this, and there'll be contact information in the COMAR as well, or on the page of like, hey, this is we manage PRP programs, etc. I would say, hey, I am a nurse. I have worked with psychiatric populations even before I was a nurse. My bachelor's before nursing was in psychology. Would I be considered this title that people have to be? And they're going to either tell me yes or no and give me the rationale for it. But as it stands right now, I am licensed in the right state, but do I have this designation of what they're saying? Probably not. Possibly, I'm not sure, but that's something to definitely follow up on. Is an NP, PA, DNP, or MD required? It looks like someone that has that designation for mental health services is required, but it doesn't have to be a medical doctor Doesn't have to be a DNP, doesn't have to be an NP. Looks like a licensed social worker that's licensed in the state of Maryland may be eligible. Can a non-clinical person own it? From what we saw already, no, that's not viable. I can't just be, my prior job before switching careers was working in the insurance industry. I worked as a claims adjuster, as a bodily injury adjuster, as a subrogation specialist on attorney represented files, as a workers' comp adjuster, all of these things. It doesn't look like I could just come in with those licenses and start this. That's not how it's set up, right? Cannot own it from what we're seeing so far. And then I have a little space here to put any extra notes. Now, as far as saturation and recent regulatory changes, we're going to switch gears and we're going to kind of wrap up this program because I told y'all I came on here, I was feeling a little sick, but I was like, I'm going to try to be consistent on my Monday Night Lives. So I'm going to go back to Google here. And if this were my Chrome, I would go ahead and be saving this part of the regulation, this part of the COMAR. I'm just going to put, are there active stoppages on psychiatric rehabilitation programs or program licensing in Baltimore, Maryland? And it says, yes, there are active extended stoppages using this term, moratoriums, right? That's on the checklist specifically to check for that. On new Medicaid enrollment for PRPs in Baltimore City as of May 2026. Once again, we're always going to check that what the AI overview is saying is correct. It's saying it's a freeze for specific high population jurisdictions, including Baltimore City, from the Maryland Department of Health. And this is the quote, or this is the source that is given us. So let's check this out. This is a .gov, so we checking it out, right? This was November. Now, see, I told y'all the tea. I said they started last fall. They started later last year, going through, doing a lot of audits and seeing what's going on with these programs. So, I got connections now. I know the tea. November 26th, okay, we have some media contacts. 6-month pause for certain behavioral health provider enrollment. This impacts 10 Maryland jurisdictions and 4 provider types. Okay, so they're talking about it here. Medicaid, okay. The department wants to strengthen the public behavioral health system and ensure that Marylanders get access to high quality care, and they want to mitigate Medicaid fraud, waste, and abuse. Now, when it comes to this, sometimes these moratoriums, or when statutes and requirements change, it can be disappointing, but we have to recognize that in healthcare, we are serving people that are vulnerable. If they're coming to see you in any capacity, whether that be your group home, whether that be your hospice center, whether that be your assisted living facility, whether that be your PRP, they are in a state of vulnerability and they must have protection. When I worked as a PRP counselor, I gave it my all and I did the best that I could. My client had a roommate that was also in the same program. That roommate did not get the same care that I gave my client, and that roommate passed away. And some of the care providers involved in that individual's care continued to bill Medicaid for months after that individual had expired. And I don't use that term to be rude, but that's like the medical term. After that person passed away, after that person left this earth, they were not, how are you billing and you haven't laid eyes on somebody? How are you billing and you haven't reached someone by phone? What services are you rendering to them when they are dead? So sometimes it's upsetting when these type of moratoriums are placed, when guidelines and requirements and licensure becomes more stringent. And I'm going to just stop sharing so that y'all can really see my full face as I'm saying this. Yeah, it looks like I will have to go through that licensing process. Exactly. Um, you have to understand that these things are put in place for a reason to protect people. They're put in place for a reason to protect people, right? So on this page, it goes on to say that Anne Arundel County is involved, Baltimore City, Baltimore County, Howard County, Montgomery County. A lot of places are involved in this process, 10 Maryland counties, and they are including Medicaid providers for PRP. And I guess I should share this with you guys. Share. It is going to include the program that I'm interested in, PRP. It's going to include home health. So psychiatric services rendered in the person's home. It's going to include partial hospital programs. So PHP, that's where somebody can maybe come in, they get inpatient for a few hours a day or for a full week, and then they leave for the weekend and they come back. Or they're able to leave in the morning to go to work and they come back in the evenings and spend the night there. That's also similar to an IOP as well, an intensive outpatient treatment program. Maybe they come to the inpatient place or the intensive outpatient place, but they're coming every day for at least 4 hours and they're getting the medications they need and they're having group sessions and they're having individual therapy sessions. So it looks like this moratorium is still in effect. Now, I heard that the moratorium was over. So this is why you have to go to the source. You have to find the .gov source that's telling you what's really going on, because the chitter chatter in healthcare is not always accurate, right? I heard literally today, oh, the moratorium is over. People are moving forward. But it looks like it's a 6 month pause. And maybe they're rolling out, well, it's been about 6 months, so it should be over soon. November, December, January, February, March, April, May. So it should be over by the end of this month. This would complete the 6 months. So it says here through June 30th. Okay. The extension was extended January 1st through June 30th, right? So you want to make sure that you're getting information from the source. When we have these questions, our instinct is let me ask around, and that can get you helpful insight when it's someone that's currently owning or operating the industry that you want to get into. But sometimes the information can be wrong, right? I am a previous owner operator of a assisted living facility. I have someone utilizing a property that's been outfitted, that's been furnished, that has all the safety and security features that are needed to pass inspection. And I have been helping that person. I've worked as a consultant to that person to help them gain their licensure. And in the last few years, I just did the same process again, with someone less than 5 years ago, less than 3 years ago. And things have changed in that 3 years. So the information that I gave them, it was partially correct, but there were amendments that were added to what was required that wasn't there before. And this is why it's important that you want to get the information from a reputable site and not just go by hearsay and not just take the easiest route and ask someone a bunch of questions over lunch that is so busy doing the day-to-day operations that they may not recall the exact thing that is required or what's happening boots on the ground, right? So this is just an example right here of why this is really important to do your own research. If you're going to be in charge of such a crucial aspect of somebody's life, you should want to do the work. And if you don't want to do the work and you want to skip steps, I'll withhold judgment from you, but you're going to have to pay for someone to set this up for you the correct way. You're going to have to pay for a consultant. You're going to have to pay for legal experts that specialize in this type of licensing. You're going to have to pay, you know, those licensing and legal fees. You're going to have to get proper insurance. You're going to have to do all of those things and have a working capital reserve just to prepare for licensure. If you don't want to do this stuff and figure this stuff out on your own, you want to pay someone to do it for you that does it all the time, you know, that's up to you. But you are going to pay more. And when things change, because regulations change, because amendments are added, because statutes are changed and added, you have to think, if you've gone through this process to open it, find back that you've tried to go for this. And if you get open, but you can't maintain it because you didn't learn these things, that's not going to fall on anyone's head but yours. You still got to finish payroll if you get shut down. You know, again, consultants are amazing. We want to use them, but we want to have some understanding of what's going on behind the scenes, or make sure you have a contract with them that is included. Some people, they get a consultant to open, they cancel services, they don't have a standing agreement with them to continue to look over your books, to continue to revise your like your working documents within your business, your training documents, to make sure everything is compliant. They say, oh, okay, I'm open. Yay, this is great. I'm making a lot of money. And they don't continue to get consulting on running it. They only got consulting for opening it. So just be aware of that. So, guys, with that, I'm going to bid you adieu. We're going to come back to this build framework. Hopefully, by the next time I do this, it's going to look a little nicer than this. But I just, you know, this is a place to show you all the bare bones. This is to show you behind the scenes, share things that might be helpful, share things that I'm struggling with, share how I've built or what I'm thinking of building, and share the process with you behind the curtain. So you're not always going to get the polished stuff here, but you're definitely going to get the real. And you've learned a lot about PRP requirements today, even in this little bit of time. Somebody says this was so helpful. Thank you. Thank you. And keep in mind, you know, you can plug this into what your goal business is, right? But as you can see, it's a lot to just look up for baseline. Now, another thing that you can use for this document before I hop off is, if you are using a consultant, you don't know what you don't know. So you make sure that they know this information and make sure that they're able to document this information for you and go through questions like this with you to make sure that your expert is an expert. And if they don't know, that they'll, you know, be honest with you and say, I'm not 100% sure of that, or I haven't had a case like that. Let me check my sources and get back with you. Someone that does that is a very honest person, and you want to do business with them. All right, guys. So that's it for tonight. It's been fun on here digging into this. I might just pull y'all in every time I'm ready. Thank you. I see the chat. You're very welcome. I might pull y'all in every time I want to research something, to just give you a little glimpse into my mind and how I organize information, what I document in my journey when I'm thinking about something and trying to determine, is it viable? Is it doable? Does it fit my life? Is it a way that is good for me to serve? All right, so with that, I bid you guys adieu. Good night, everyone. I'll see you next Monday.